Hey guys, welcome back to my YouTube channel. Hope you guys are doing great. So let me ask you a question. What do you know about urinary tract infections? Well, from my experience, some pregnant women who have been diagnosed with urinary tract infections tend to be defensive. But after educating these women, what I realized was that they had the belief that urinary tract infections could be gotten only through unprotected sexual intercourse. Well, that's not the case. So in today's video, I'll be talking to you all about urinary tract infections, the symptoms, and how they can be prevented during pregnancy. It is very important to know about this because urinary tract infections can be life-threatening for both the mother and the baby. So towards the end of this video, I'll be giving you some tips on how to prevent urinary tract infections. You know, prevention is better than cure. So if you want to know these tips, please watch this video to the end. And if you haven't subscribed to my YouTube channel, please do that by tapping the subscribe button below and turn on your notification bell so you won't miss any of my upcoming videos. Okay, the urinary system is made up of the renal pelvis, 2 kidneys, 2 ureters, a urinary bladder, and the urethra. So a urinary tract infection will occur when a bacterial infection occurs on one or both of these organs. And the most common type of bacterial infection or urinary tract infection is called cystitis. Cystitis is inflammation or infection of the urinary bladder. And this is commonly caused by a bacteria known as E. coli. This bacteria is found in the gastrointestinal tract. And women should be aware that they are more likely to have a urinary tract infection than men. This is because women have a short urethra. So this can cause bacteria to easily move up to the urinary bladder. And they should also be aware that the risk of having a urinary tract infection becomes higher during pregnancy. This is so because the urinary bladder is in close proximity to the uterus. Thus, the urinary bladder is just below the uterus in the pelvis. And considering the fact that during pregnancy, the uterus increases in size, it can really mount pressure on the urinary bladder. So this will make it difficult for pregnant women to empty their bladder completely during urination. So this can cause urine retention, and urine retention can promote the growth of bacteria. And coupled with the fact that hormones like progesterone are being increased during pregnancy, it will cause the ureters to relax. When the ureters are relaxed, they can easily bend or be twisted. So it will be difficult for urine to flow from the kidneys down to the ureters and into the bladder and out of the urethra. So this can also help promote the growth of bacteria. And it is advisable that pregnant women should be aware, and health personnel should also be aware, that not all urinary tract infections will cause symptoms. That's why it is advisable that all pregnant women should be screened for asymptomatic bacteria during their first antenatal visits. And for those bacteria or urinary tract infections that will come with symptoms, these are some of the symptoms that you can have. Now, the first symptom that some pregnant women may experience is frequent urination. That you may have the strong urge to urinate, but when you go to the bathroom, there might be little or no urine that will come out. And the second symptom has to do with lower abdominal pains. You may have frequent on and off lower abdominal pains if you have a urinary tract infection. And the third symptom will have to do with cloudiness in your urine. You might notice some cloudiness in your urine, or you may notice some dark or concentrated urine, or you may notice bloody or foul smelling discharge in your urine. These are some of the symptoms that pregnant women can experience when they have urinary tract infections. And not forgetting, that can also be a burning or a painful sensation during urination. Like I said before, prevention is better than cure. So I'm going to be telling you all some tips on how to prevent urinary tract infections during pregnancy. The first tip has to do with consuming at least 1.5 liters to 2 liters of water daily. I know this can be difficult due to the fact that most pregnant women experience nausea and vomiting within the first 3 months of pregnancy. But you really have to try in order to prevent these urinary tract infections. So consuming these fluids will help your urine to be more dilute, and this will ease urination. Now the second tip is that you need to practice safe sex. This doesn't necessarily mean that you need to use a condom always during sex. But what it means is you need to get a bath and you need to urinate before and after sex. This will help to prevent the growth of bacteria to the urethra and into the bladder during foreplay. So having a bath and urinating before and after sex will prevent urinary tract infections during pregnancy. Now the third tip will have to do with prevent douching. You don't have to douche the vagina. Most women think the vagina has to have a good or a nice perfume smell, but that doesn't have to be the case. You need to be aware that the vagina has its normal bacteria which keeps it clean. When you douche your vagina by sticking fingers and detergents into the vagina, it kills that normal good bacteria in the vagina and keeps the vagina vulnerable for bacterial infections. So douching during pregnancy should be avoided. Now the fourth tip is about maintaining good hygiene in the bathroom. What do I mean by maintaining good hygiene? That's after you use the bathroom, that's after urination, you should clean from front to back and not the other way around. What do I mean by front to back? You should clean your vagina from the vagina towards the perineal area, not from the perineal area towards the vagina, in order to prevent the growth of bacteria in the vagina. So these are some of the tips that can really help you to prevent urinary tract infections during pregnancy. So if this video was helpful, guys, please comment below and tell me what you think. And don't forget to like my video, subscribe, and turn on your notification bell so you won't miss any of my upcoming videos. And of course, my next video is coming up this Sunday, so stay tuned for it. And thank you all for watching my video. I love you all, but Jesus Christ loves you more. Have a great day.